Hello, this is Dr. Gary Cockrell with Cutting Edge Foot and Ankle Clinic. I wanted to talk to you for a minute about ingrown toenails, which is a very common problem in the general population that we see in our clinic almost on a daily basis. Ingrown toenails are caused by usually 4 factors: genetic predisposition with a family history, prior trauma, ill-fitting shoes, or improper trimming of the nail. The nail should always be trimmed straight across, following the natural curvature of the nail if at all possible. If you have a sharp edge on the corner, you can gently try to file that down with a nail file, but never ever be too aggressive and do bathroom surgery and try to remove the ingrown nail on your own. You'll only make it worse and possibly create an infection, which would prompt a visit to the office. Another problem we see with ingrown nails is they're often caused by improper technique by the technicians at these nail salons. They tend to be too aggressive and dig too far back on the corner, and never ever allow them to do that. Again, you will end up with a more significant problem and make the ingrown nail worse. If the condition is very mild with very mild symptoms, make sure your shoes are wide enough in the toe box, and sometimes if you just gently trim the corner out, it'll go away. But if it persists, it may require a more permanent procedure that we can do here in our office with little or no pain. So when we do this procedure, it's called a partial nail avulsion with matrixectomy. We put the toe to sleep with local anesthesia with a nerve block. We have a cold numbing spray that we spray on the base of the toe. We do not inject the toe in the area of the pain. We do it at the base of the toe back here, away from the area that's ingrown. So we numb it with a freezing spray so you never feel the needle going in. The only thing you'll feel is a mild burning and stinging momentarily while the anesthetic is being injected in the toe. After that, you won't feel anything at all. And we always check for anesthesia before we start the procedure. The procedure is very short. It only takes about 10 minutes on average. We remove just the offending ingrown nail margin, just a few millimeters of width of the nail on the offending side. We usually do not have to remove the entire nail. And once that ingrown nail margin is removed all the way back to the growth plate of the nail, the root of the nail, what we call the matrix, then we chemically cauterize the corner of that nail that's causing the ingrown nail. So that will permanently prevent the ingrown nail from ever occurring again. The success rate's really high, about 95 to 98%. It takes about 3 to 4 weeks for the wound to completely heal, start to finish. Typically you'll have some mild soreness for the first week or two, and you can engage in most regular activity the day after the procedure. And then we usually see our patients for one follow-up visit 2 weeks after the procedure. Contrary to popular belief, we normally do not have to remove the entire nail. If you go to a primary care clinic or a walk-in clinic, a lot of times, since they're not trained in this specific procedure that we do in podiatry for ingrown nails, they may want to remove the entire nail. Again, we usually do not have to do that unless there's acute trauma and bleeding underneath the nail where the nail is significantly loosened from the nail bed, in which case the nail would have to be removed. But in most circumstances, we can simply remove just a small portion of the nail, which would be the ingrown nail margin, and leave it untouched and intact. So cosmetically, after the procedure is healed, the nail should look normal, but the pain will be gone. And when you have this procedure done, you'll get virtually immediate relief from your pain. So please consult with us. We have 5 locations. If your problem is more persistent and doesn't go away, we can help you and explain the procedure and get you through the procedure with little or no pain, and that would solve your problem once and for all without any further treatment. Thank you.